Welcome to this introductory seminar on ethics for speech and language therapists and others working to support the needs of people with communication swallowing difficulties in Cambodia, Ghana, or Vietnam. The background to the development of this seminar and other related resources is described in this slide. This online seminar provides an overview of ethical principles and applies them to some scenarios which might be experienced when working in speech and language therapy in a country like yours. This presentation will be followed in the coming months by some further resources that can extend your learning about ethics in speech and language therapy. Today's online seminar will be presented by Helen Smith, who is a senior member of Speech Pathology Australia's Ethics Board and has a long-standing interest in both development and in ethics. Thank you, Helen.
Hello, I'm Helen Smith. I'm a senior member of Speech Pathology Australia's Ethics Board, but more importantly, I spent several years working in Zimbabwe. I'm going to be your presenter today and we're going to work through the workshop together. So I look forward to being with you. An important part of ethical reflection is a space to reflect on your own practice, and we're going to be doing this within the workshop today. You can either do it in a group if you're with others, or if you're on your own, click on the link and you can do it on your own in the workbook attached to the link. Take a moment now to read the learning objectives that are associated with this workshop. They'll be presented to you in your own language and in English if that's of assistance. Start with an activity. What I want you to do is complete the activity, which is reflecting on ethics in the everyday work that you do as a speech language therapist. Please pause the video now and complete the activity identifying which of these areas in your day may involve an ethical component. We want to start thinking about work and thinking about positive examples of people in your workplace who you've seen behaving ethically. What is it about their behaviour or their actions that make you feel that they're ethical professionals?
When we're thinking about ethical issues, it's important that we reflect on our values. Values are things that we believe or think are important and influence what we believe is ethical. It's important to recognise that people from different backgrounds may have different values. When we're thinking about ethical theories, it's important to recognise that ethical thinking is complex and often there are no clear-cut answers. There is no right or wrong. The goal of this presentation is to encourage you as participants to think about some of the complex issues we face in our practice when working with people with communication and swallowing disabilities, and to understand the ethical principles that can help us think these complex situations through.
Now we're going to take a moment to complete an activity, and again you can do this in your workbook, or you can do it with your colleagues, or you can do it just writing down on your own. But first of all, I want you to think about what has influenced your personal ethical attitudes and values. Then what has influenced your professional ethical attitudes and values, And finally, what are the most fundamental values that you bring with you to your work as a speech language therapist? You need to pause the video now while you complete this task. Respect is an important part of ethics, and it influences how we think about and behave with other people. We're going to do an activity now where we think about the importance of respect in different aspects of our life. So first of all, what does respect mean to you? How do you show respect to different people? And finally, how may respect and the showing of respect differ at home, in the community, and finally in the workplace? Pause the video now and complete this activity. About respect in healthcare settings. So research has shown that respect from healthcare staff is perceived by our patients and clients as polite behaviour, listening and patience, reassurance, providing any required information, and time management. But also from a whole service perspective, a service that is well organised, a service where there's a clear flow of information, demonstrates respect to the people who we serve. Respect is actually thought about too from an international perspective. There's an international patient dignity scale that includes respect for the person as a human being, respect for their personal feelings and time, respect for their privacy, and respect for their autonomy, their right to make their own decisions. This workshop is focusing on the principles of biomedical ethics that are contained within the Speech Pathology Australia Code of Ethics. The first four principles, beneficence and non-maleficence, truth, fairness and autonomy, are generic principles, but Speech Pathology Australia adds an additional principle of professional integrity, and we're going to unpack those ideas and explore them further. So the first principles we're exploring are very tricky words, beneficence and non-maleficence. And what do we mean by those? Beneficence means that we bring about benefits, we do good to those that we serve as speech language therapists. Non-maleficence means that we avoid harm. But what do we mean by harm? Harm can refer to physical harm. It can also refer, though, to psychological harm and even social harm. So it's really important that sometimes we may have intended and unintended impacts by our behaviour, and we need to think about, could that bring about harm? When making decisions, speech and language therapists need to think about what good and what harm may result from the decisions that they're making. We're now going to look at an example of beneficence and non-maleficence. The very first example is about working with a child with cerebral palsy, with quite severe swallowing and eating difficulties, who is presenting with what appears to be repeat aspiration pneumonia. There are 2 questions for you to consider now. So what I'd like you to do is pause the video and write down what you think you would do and what options you think are available for this family and child based on the scenario. Okay, so one of the things that you will have already identified is this is really complex. There is actually no right or wrong answer. The ethical approach to doing good and not doing more harm in this situation involves the complex interplay of the family, their circumstances, their finances, their living, the medical advice, the medical access to treatment they may or may not have. It's all about all those factors together to try and work out what will be the best for this child to do the least amount of harm to this child and their family in the circumstances to which they find themselves.
In this scenario, imagine you're starting to work in a rural area for an organisation for children with disabilities. You realise that lots of the children actually don't have a medical diagnosis or a clear indication of what's causing their disability. You are encouraged to refer families off to the city to see a specialist paediatrician so they can receive a diagnostic label. I want you to think now about what may be the positive outcomes of sending the children into the city for a diagnosis. What might be some of the harmful consequences of sending children to the city for a diagnosis? Pause the video and write your answers now. One of the things that we know is that a clear medical diagnosis can be really important for families because it really helps them understand the cause of their child's difficulties and challenges. In a few cases, there may be additional treatments that could help the child to have a better outcome if the diagnosis is clear. So for some families, it can be really helpful. Having a diagnostic label can sometimes mean a child can access a particular specialist service. That might include particular therapy services or perhaps even funding for extra support for the family. And so that can be a really positive reason to have a specific diagnostic label. For other families, it may in fact do harm. A label might mean that the rest of the community want to marginalise the child because they're now known to be different. In some cases, having a particular diagnostic label might mean that mainstream education services may say they cannot see that child. The child may be excluded from some services on the basis of a specific diagnosis. So you can see something as simple as having a diagnosis can sometimes be both good and harmful. The other really important consideration, particularly for many of our families who don't have a lot of money, is the cost of diagnostic labelling. The costs involved in getting the child with a disability to the city, the costs of seeing the paediatrician, the costs of the testing that may be required, all of this could be a substantial burden on families, particularly when they may have to make a choice between the costs of schooling and the costs associated with the diagnosis. So again, you can see that ethical thinking involves thinking about the benefits and possible harms of each choice or approach. The final principle we'll consider today is around justice or fairness. Justice is about how we use our resources within the community that we live. It means that everyone in the community should have an equal chance of receiving the services they need. So it's not just the rich or those who have money to pay or those who know how to access the services that should receive the services. As ethical speech and language therapists, it's up to us to find ways that will make our services and their access equal and fair to all who require them. One of the things we do when we think about justice and the ethical application of justice is to seek to ensure that clients and colleagues receive fair treatment. For those of you working in countries where there are few speech therapy resources, it means that you need to look at how the different people in your community may be able to receive the assistance they require.
Now we're going to have a look at a case scenario involving justice. You're working with a young child and their family who has autism but very good behaviour. The family have approached the local school to get a school place as they're 6 years of age. But the school has said, oh no, because your child has autism, you have to go to the special school. The special school, however, is a long bus ride every day and a great expense for the family. What's your role as a speech pathologist to ensure justice for this child? What could you do, both as the person's therapist, but also what could we do as a profession to help make this situation more just? Write those thoughts down now. So part of our responsibility as speech pathologists is to help the community understand the impact of different disabilities and to advocate strongly for people with disability and their right to access services. Now, many of us would know some children with autism and their behaviour are going to have a negative impact in the classroom, and so you can understand how a school might say a child with that diagnosis needs to go somewhere else. However, we also know that many children with autism perhaps can be very compliant in the classroom, and that in fact it's about helping the teacher to understand about their condition and empowering the teacher to embrace them in that situation that can allow success for that child. So as a speech pathologist, not only do we have obligations to provide therapy to the child and their family, but to act as an advocate to provide justice for children to access the services that they require in the broader community. So I also want you to think more broadly beyond this particular child. What could your organisation do to advocate for children with autism? Do they need to get together with parent groups and the educational authorities to come up with ideas around what might be best practice for the children in the whole community around accessing appropriate educational services? What kind of support can you as a group of speech pathologists and a group of parents and a group of educators do to improve the lives of children with autism? We're still thinking about justice, but in a different circumstance now. You're working in a hospital rehabilitation setting with a man with chronic aphasia. He's referred by his doctors for intensive speech pathology. He's very affluent and politically well connected, and your medical director agrees with the doctor that this gentleman should have intensive therapy. However, because of the chronic nature of his aphasia, you know from the evidence that in fact, and from your experience of providing some intensive therapy, he's not able to benefit from intensive therapy in this way. Is it ethical to provide him with intensive therapy when that means someone else misses out? How would you work in this situation? What's your ethical obligation with regards to justice? So when we think about this scenario, we need to keep in mind that in fact what we know about chronic aphasia is that people do benefit from intervention, but it's not about intensive one-on-one intervention necessarily. Often it's about less frequent, more socially based intervention with families. So how do you work in this situation to actually ensure that this gentleman gets the right kind of treatment, and that the right kind of treatment that he could benefit from might also benefit many others who are requiring that service within your therapy context? But also, how do you work then with the people in power, the medical director, with the hospital director, and with this man's family to help them understand that in fact, whilst therapy is required, it's not in the form that they're specifying to you. It's a challenge, and it's a challenge for all of us. But not only is it about justice for making sure that we have services available for the people who can benefit the most, it's about also providing the right kinds of services that will actually benefit the person at that stage in their recovery journey. The next principle of biomedical ethics that we're going to consider is truth and truth-telling. The concept of truth in ethics is that we provide the people that we're working with accurate information, with the truth. But truth-telling is not just about giving information. It's very complex about how much of the truth we give, over what time period, in what pieces of information that we give at any particular time, because not everyone is always ready to hear the whole truth in one foul swoop. And sometimes by bluntly telling the truth, we can in fact do harm. Truth is all also difficult because sometimes we don't know the truthful answer. When a patient with amyotrophic lateral sclerosis or motor neurone disease asks us, well, when will my speech and swallowing be affected? How long do I have to live? We can't actually give an accurate answer because the truth varies from person to person. Likewise, when parents ask us, well, how frequently and how much therapy is my child going to need? It's really hard to answer because that is going to be dependent on the child, their condition, the family, the backup that's available. And so sometimes truth is actually much less black and white than we imagine. So now a specific patient example around truth and truth-telling. You're working with an elderly woman with dementia. She's been admitted to hospital now for the 4th time with an aspiration pneumonia. Her daughter doesn't understand why you're not providing intensive input. She's already made a complaint to the hospital system, and when you come in to see the woman, you realise that in fact she's dying. What do you say to her daughter, and how do you tell her the truth about this condition? Just pause the video now and write down some reflections. So one of the things that we do as health professionals is that we have a whole lot of knowledge about how conditions roll out. And whilst we may not be able to say that this lady is going to die in the next 24, 48 hours or the next week, this is a pattern that we're very familiar with. So perhaps we need to very gently explore with the daughter what she understands about what's going on and what expectations she has for her mother's recovery as we try and give her little pieces of the truth about really what our clinical judgment is about her mother really rapidly approaching the end of her life. This not only ultimately will give the daughter the information she needs and the truth, but is actually a really kind way and a caring way of giving what is actually very confronting news to a family member about their loved one. And sometimes it's not our job to tell the whole truth. In fact, we often need to do those complex family meetings and family information giving with the whole team. So whether that be your medical colleague, your nursing colleagues, your social work colleagues even, to try and provide the necessary support, but also to provide all the information. So it's the doctors who can provide the very clear diagnostic information. It's us who can talk about a person swallowing. It's the social workers who can talk a bit more about how we can care for the person and the family in that situation. We're now going to consider a truth-telling scenario at more of a service level. You're working with a colleague in a clinic. One of your colleague's clients, family members, sends you a letter saying they don't think that your colleague is competent in treating their family member. What do you do with that information? How do you communicate that in a way that doesn't do harm to either the client or your colleague? Write down your answer now. So as a speech therapy professional, what do you do? What's your obligation both to the client and to your colleague? How do you sit with your colleague and help them perhaps understand that there may be a different way they could approach their treatment of the client if you actually do feel that perhaps they don't have the skill level? How could you work together with that colleague to both build their skill and develop their practice, but also ensure that the client has the best service that's available? It's a complex issue to weigh up that conflict between doing right by the client and doing right by your colleague. But as ethical professionals, we have a mutual responsibility to ensure the standards of our profession and our professional colleagues, but also the standard of service to our clients. Now we come to autonomy. Autonomy is the principle that says we respect the right of our clients to make informed decisions. But people have the right to make their own choices and to have all the information they need to make those choices. And as long as they make choices that aren't actually going to impact on the freedom of other people. So that's also part of the complexity of autonomy. However, consent and informed decision making and autonomy is often seen as a very Western principle, a Western concept. Because in some cultures, in fact, it's not the individual themselves that might make that decision. It may be a family member, it may be a community. And so trying to work out whether autonomy is actually the principle that we need to follow, or the do no harm principle, in that we need to include the right people in the decision making. And how we work out what that is sometimes quite complex, and it might be different in a city situation versus a remote village situation. And it might be different according to religious and family context as well. So autonomy, again, seems like a very simple, this person has the right to make their decision, but it actually becomes much more subtle and nuanced as we go. The other thing about autonomy is that we all know people that we work with who actually can't anymore make informed decisions. And then we need to think, well, who has the right to substitute their decision making? And who is the right person to speak to in that situation? And in some places there may be legal obligations around that, and in other places, again, it may be a cultural expectation. You're working in a village that's a long way away from the city. You're working with a child with a hearing impairment. There's a school for hearing impaired children in the city, and this child's school teachers have organised a place at the school for the hearing impaired children in the city for this child. They tell you that you have to tell the family that they have to send the child to this place in the city. What do you do? Who has the right to make this decision for this child? How do you think you could talk with both the family and the teachers about this decision-making situation? Write down your reflections about that now. we're considering autonomy, we need to think about who has not only the right to make the decision, but the impact of the decision making. For many families, sending their child far away in the city, if there aren't family supports, if there's no one that child can have contact with, may actually be doing more harm. Perhaps the family don't have the money to even pay for fares to the city or to visit the child in the city. And is the benefit from developing perhaps access to signing or a community of deaf people around that child of greater benefit than remaining in their own community? Is it the teachers who can make that decision, or is it the family? And how can you help the two of them come together to try and work out what might be best for this particular child and this particular family in this particular set of circumstances? Autonomy is saying we need to give all the information and all the options and then allow people to make what for them is the best choice. You're working in a hospital and you have an amazing paediatric colleague who wants to start to refer children from the community into your speech therapy service. You know that early intervention for children is a very important part of improving the children's opportunities as life progresses for them. However, you do work in a hospital and your CEO has said that you are only allowed to work with hospital inpatients or children who have been inpatients in the hospital. What do? You know the evidence tells you that early intervention is best. You know the paediatrician is identifying children who could really benefit from your services. But the CEO is very clear about who can and can't access the very small service that you offer. And you are the only speech therapist in town. Write down now your thoughts about what can you do. So I have to say, as a health service manager, that often what we can and can't do is dictated by our CEO or board. But our obligation as ethical professionals is sometimes to help convince that person of why, the evidence behind why we would like to do things differently, or the impact of how doing things differently might affect their bottom line or their hope for the future. So rather than just sitting there and biting your tongue and feeling frustrated and feeling like you're letting down your fabulous paediatrician, perhaps you and the paediatrician could sit down and come up with an argument, some evidence to present to the CEO. Perhaps the paediatrician knows some people who might sponsor some places so that there could be a way even of generating some income for the hospital in seeing those children. There are many ways to solve a problem, and as part of our ethical obligation, we need to respectfully, step by step, help change and influence the people around us if we truly believe that there is a different and perhaps a way of doing more good in our actions. And so it is about presenting evidence clearly and appropriately to the CEO in the right environment. It's not to do it in public. It's not to do it in a way that will embarrass And it's not to do it in a way that says this is an all or nothing, but simply to try and help change, influence that process. And it might take a long time, and you might have to do that educating over and over again in different ways, but again, always very respectfully, and always with the sense that this is the way that we can do the most good for the community that we serve. Our final principle isn't in fact one of the 4 biomedical principles, but it is a Speech Pathology Australia principle and very relevant to our work as speech language therapists. This principle is concerning professional integrity. Now, what do we mean by professional integrity? Professional integrity means that we're respectful, that we're competent, and that we work within the ethical and legal guidelines for ourselves as speech language therapists. What we have to do is ensure that as speech therapists we're competent in the areas that we practice. This may change over time. We may find ourselves in new areas of practice, and we may have to upskill, we may have to get mentoring, we may need to get new guidance to ensure our competence. Another aspect of competence is if we're unwell, and whether that's a physical illness or a mental illness, that means that we can't practice competently. We may need to take some time out, get ourselves well, and then come back and practice again. Finally, we also have to think about the fact that in many countries, new professions don't necessarily have ethical and legal guidelines. And so how do we as a profession start to grow those as we move the profession forward in a particular place, in a particular time? Today, through this presentation, you've heard me mention the word code of ethics. But what is a code of ethics? It's a document that reflects the principles and values of a profession. This is something that you as a new and fledgling profession in your country might want to consider. Where countries have a new speech therapy profession, they may want to look to other countries to see what they've done in forming their code of ethics and find one that fits for them, or write their own that fits for their context and their country. I want to let you know that you're not alone. Speech language therapists around the world face ethical dilemmas. We've even done some research into the kind of ethical dilemmas that speech therapists face, both at the beginning of their careers and even well in advance of their careers. Some of those ethical dilemmas include the tension between the service policies, what our organisations tell us to do, and the values of the profession. The resource allocation, how do we decide who gets our very scarce therapy services? And how do we prioritise when we have 10 very legitimate needs? How do we decide who gets the most? There are issues around workforce and workforce competence, and also around who are our service users and how do we deliver services in the best way possible. We're almost at the end. Do you remember back at the very beginning, we had a list of the kind of things that you'll do every day in your work as a speech language therapist? I want you to revisit that list now and think, is there an ethical component to that aspect of my job? Is there something I should think about ethically when I make that decision every day? Stop now and go back to that list and write down which ones you think may involve an ethical component now. So take another moment now and look at your first list and your second list. Has your thinking about ethics changed over the course of this workshop? What I want you to consider is, are you now more aware of how much ethics is embedded in everything that we do? In your workbooks, some of the ethical issues about each of those aspects of our job will be given as examples to help you to think further about how ethics is part of what we do every day as speech language therapists. As you can see from your workbook, all of these activities that we do every day as speech language therapists have ethical issues embedded in them.
Today, you have learnt about the relationship between values and ethics, respect and ethics, and you've begun to learn about the principles of biomedical ethics and how they apply to your practice as a speech and language therapist. I would like to thank you for participating today, and I really hope that this has been a useful time to encourage you to think about ethical practice in speech therapy, and particularly around ethical practice with people with speech and language and swallowing difficulties. Please continue to look at this website for other resources around ethics and ethical practices and activities to support your learning about ethical practice in speech therapy.
For those of you doing this online in 2019, there will be an opportunity in your home country to attend an ethics workshop. For those of you who perhaps aren't doing it in 2019, there will be an increasing number of resources and some packages of education for you available on the website. So please continue to look and find the updated materials. I'd also challenge you that in your mentoring and supervision sessions that you unpack ethical dilemmas as and when they arise. It's with our colleagues that we can often get much clearer in our thinking about what should we as speech language therapists do.